this private insurance
Yes.
and the NHS insurance.
Yeah.
What I'm trying to ask is, this NHS insurance, does it cover everybody under the NHS?
Now, everybody that is in the UK, so far as you have the right to stay or work in the country,
Yes.
you can enjoy something from the NHS, including
Okay.
you, including you. That is why
Okay.
you're able to go to the GP and all that if you get sick,
Wow.
you know?
Yeah. Yeah. Yeah.
Exactly, exactly. But then
But
it
at the
is
GP, I saw they are still collecting money for drugs from me. Is it supposed to be like
Ye-
that?
yes,
Medication.
yes, 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 including myself. Even me, I'm a British citizen. If they give you a prescription, you have to pay for it.
Okay.
You
Okay.
get my point?
Okay.
But it's on a reduced price. You understand? Should you have gone to the pharmacy to buy that same medicine to be higher?
To be
The
higher.
price should be
Okay.
higher. But because the GP has given you prescription, it is cheaper
Okay.
because the
Okay.
government subsidizes some of this. Do you understand?
On the money.
But should
Okay.
you have just walked to any pharmacy and say, I'm not well to get medicine, it's very expensive normally.
Okay.
You understand? So I, even as a British citizen, I still pay for prescriptions. However, for those of us who are here who are British citizens, there are other things that we can apply for that they can exempt us. For instance, if you're on low income, okay,
Okay.
or if you are not working, you can apply for some NHS exemption certificate that you would allow you that if you go to dentist or any other thing, they'll give you a discount. But you will
Okay.
not qualify for that. You understand?
Okay.
That.
Okay.
Yeah. So if you get one, you are free. You can go to the hospitals and everything. You won't pay for. You should know this by now. You
Okay.
understand? But
Okay.
it is limit. Everybody is limited. There are certain things. If it's expensive, you have to pay top up or pay. Do you understand me? That's
Okay.
probably I will not because I have a full as a British citizen. You understand?
Okay. Okay. Okay.
So it's all about what is available as a person. Everybody based on merit. Okay. So there
Yeah.
are basic things that you can enjoy. GP, go to the hospital. If there's no you won't pay for. But if it's like something like a surgery, you understand?
Yeah.
Something involving, they have to now look into your visa status. Okay,
Mm.
does it qualify you for the government to pay everything for you? You understand? Or some will be done for you. You have to do the top up. Okay,
Okay. Like on my own, I have a surgery, and I think the government is paying for everything.
everything amazing,
Yes.
amazing, amazing. You understand?
Yes.
So that is it. So it means that you still have all those benefits. You understand?
Okay.
Even
Okay.
though it shows no recourse to funds, isn't it?
Yeah.
In your cars, it shows no, but you still enjoy all those things because the NHS is for all. You understand?
Mm.
Even those who don't actually here and visiting visa, they still go to GP,
Wow.
still go to GPS, and they take care of them.
Okay.
You understand me?
Yes, sir.
Uh-huh. Okay, let me proceed.
Okay,
So
sir.
I said that the care plans have this. What it does, its aim is to encourage and support you to live independently. That's the service user. And
Yeah.
then another thing is that to have as much control over your own life as possible, to participate in society as equal. Supported living. If you look at some of the activity or daily routine, sometimes you have to take the patient out. I don't know if you know, take them for
Yeah,
walking.
you take them out for
Exactly. So
shopping, for
all for
sports.
shopping. Thank you.
Yeah,
Thank you.
all those
Thank you. So
activities.
all you seek to do is to just help the person to recover and be happy. You understand?
Yeah.
You are there not a boss on your own, but you are there to ensure that what the person wants is more about him and not you. You understand?
Mm.
Yeah, we stick to wherever they want. Sometimes we take them out for even smoking. You know,
Yeah.
those who smoke, take them for smoking, take them for shopping. There are some who drive. You have to drive their car
Mm.
around, drive around and come back. You understand?
Yeah.
Should be involving in the entire um, um, care plan. To have access to employment and family life. And when we say family life, there's a legal requirement, what we call the European Law of Family Life, Article 7. Okay,
Mm.
7. Yeah. So we have the European. The UK used to be in the European. You know that until not
Union. Yeah.
recently we moved that. So the
Yeah.
European law overrides the UK law for many years until recently that we came out of the EU. So
Okay.
we have what we call the right to family life and the right to live. Okay. So
Yeah.
legally by law, and your family, if there's any issue against you and your family, you can fall on the Article 7 of the family life, okay? And say that
Mm.
because my family have a life here, and for instance, you, if anything happens and they want to deport you to Nigeria, which I
Yeah.
refuse that, you can fall on the right of family life because you have wife and children here, okay? Any
Okay.
good lawyer can fight the case for you, okay?
Okay.
Because you can use the article conversion by law and say the right of family life. You have a family and children, and that's the reason why you think if they deport you to Nigeria, it will hinder your children's upbringing. You understand me?
Yeah. Yeah.
Thank
Yeah.
you. So, do the lawyers can look into this. It's called right to family life, and then we have to right to stay or right to live.
Yeah.
Yes. So these are you can read about it's called European Human Rights Convention. Okay.
Okay.
Yes. So if you've heard many um there are a lot of people that they don't have they don't have documents here, they are still in the UK.
Yeah.
If for any reasons you are being approached by the Home Office and they get hold of you and you are being deported, a very good lawyer can fight your case for you, especially when you have children in this country.
Wow.
You understand? So you
Yeah.
may have children here, but you don't have papers. You understand? You don't have quali.
Mm.
But you can fight your way. A good lawyer can fight your way because once you have children and you can prove reasonable that by you being deported to Nigeria, it will affect your children upbringing. You understand? As a
Yeah.
father, and your wife can also support and say you have been a responsible father, even though you don't get quali and all. So all these nitty-gritties and the prima facie evidences and these things can help you to fight your case. Okay.
Okay. Oh.
So that's what I told them. Yeah, I told them, so I don't know what to work on this year. Take it in. Okay. Take it in. Okay. Okay. That is good. So actually, I got actually. No, but and check it out. And if I get to what out of there now, right? Okay. And now if I get, I didn't mean
Yes,
are you getting me? So
I'm with you, sir.
this is just digress. Another, I mean, I'm into law as well. Okay.
Yeah.
This is a
Yeah.
bit of law distance. So these are things that you guys have to know as well.
Okay.
Yes, okay. You can read about that, right?
Okay. Okay.
In this country, there's so many issues here against families, a lot.
Wow.
Yeah, yes, safeguarding is not a small joke here, you know that. Safeguarding is not anything. If your child goes to school and even goes to lie, say, Daddy slapped me, you are in problem.
Mhm. Wow.
Yes, yes. If the daddy hits my boom boom, eh?
Mm.
Even Africa now, our children, but here it's different.
Yeah.
A
Yeah.
little thing that your child even jokingly and says that daddy hit me at my back or mommy slapped me, you are in trouble.
Wow.
You are in big trouble
Mm.
because the school authorities will take it very serious. You understand?
Yeah.
Don't slap your child, and they will
That's
report it, and you are going to be big trouble. They will get the police involved. They'll get the social service involved. Once they do that, they can even ask you not to see your child anymore. It's a big problem.
wow.
The UK safeguarding is a big issue in the UK. A
Mm.
very big issue. Yeah, okay. So our children, yes, they might just say something. Maybe Africa now, you can just touch your son or your daughter, but
Yeah.
they interview them. And what they do is that they always like to interview their children, even if they are not ready to speak. They want to always see,
Mm.
exactly. So this is how the UK is. The system is a bit funny. You understand?
Wow.
All right. Let's proceed. So we have to look at organization, the choosing country. So you have to look at current healthcare system in the UK. The UK has a government-sponsored universal healthcare system called the National Health Insurance. You know about it. You spoke about the NHS, right?
Yeah, I know about it.
Okay, so it's a funded healthcare system. So it's funded by government. You understand? To help
Okay. So,
everyone that finds himself in the UK. Exactly. But like I said, the funding is limited to everybody. Maybe your surgery or it's not too much money, probably. But maybe if it's a lot of money, probably they'll say, you understand? Maybe you
yeah.
have to pay something extra, It includes the National Health Service England, the NHS Scotland. You know, the Scotland also have its own NHS. You know that.
Okay. I'm
Wales
just
have their own NHS. Yes, yes. Even though it's a Great Britain, the
yes.
NHS can. Yeah. So we have. It used to be NHS for all, but now we have NHS Scotland, we have NHS Wales, and we
Yeah.
have NHS England, which me and you find ourselves in. Okay.
Okay.
Exactly. Then we have the Health and Social Care, Northern Ireland. Okay. So citizens are entitled to healthcare under this system, but have the option to buy private. You understand? So
Yeah.
even though we all qualify to enjoy from the NHS freely, you can also decide that you want to have an additional private insurance as well, and nothing stops you. In fact, very good companies in the UK, if they employ you, in addition to the NHS that you qualify, they also provide you private healthcare. You know, very big companies, they're very good ones. Okay,
Yeah.
provide you private sector, private insurance, and I'm sure the same in Africa as well, don't they? In Africa, very big companies, you have your government system, but they also provide you private, don't they? It's normal.
They do. Yeah, they do.
Exactly, exactly, exactly. So it's the same. It's the same. The same. So we have to also describe the organization. So NHS plan promises more power and information for patients, more hospitals and beds, more doctors and nurses, significantly shorter waiting times for appointments, improved healthcare for older patients, and tougher standards for NHS organizations. So these are things there. So the patients, the hospitals, the beds, the doctors, these are all the headaches of the NHS um, trusts, you know, to look into it.
Mm.
Then we have to also look into one of is most efficient in the world according to the state. So UK's NHS one of the best in the world. Okay, one of the
Yeah.
best in the yeah, one of the best in the world, and they look into perform very well in quality, efficiency, access to care, equity, and healthy lives. Very important. Then the healthcare system in different regions of the UK. So let's look at the United Kingdom as a devolved matter, meaning England, Northern Ireland, Scotland, and Wales each have their own system of private and public funded healthcare, as well as alternative, holistic, and complementary treatments. The
Yeah.
fact that each country has its own varied policies and priorities has resulted in a number of differences between the sectors. Each country provides public health to all in UK permanent residents, and each also has a private healthcare. So they both have private and public. Okay.
Okay.
Whilst in England, it is provided by the NHS. Social care services are shared responsibility between the local NHS and local government. So you see, the NHS is a healthcare provider, okay? But when
Okay.
it comes to social care, which involves supported living, dom care, is more to do with the council, the local council, okay?
Yeah.
You understand me?
I
So
guess so.
those referrals comes normally it comes from the council. Anything about social is more to do with the council. So the budget is more to do with the council, okay? As to
Okay.
how much funding the council have to be able to give out for a particular year. You understand me?
Okay.
Exactly, exactly. So it's more to do with funding. So the local NHS and local government director of social services and falls under the guidance of Department of Health. Very key. Similarly, most healthcare in Scotland and Wales are provided by the NHS, Scotland NHS rules. Expected. We are behind time, but because of the internet, but I'll wrap up quickly. The majority
Okay.
of healthcare in Northern Ireland is provided by Health and Social Care in Northern Ireland, which is still, hold on 1 minute. It's still working. Okay. Describe the organization in Health and Social Care. Healthcare in UK, United Kingdom publicly funded, generally paid by tax, as we all know.
Yeah.
However, the UK has a private healthcare. We all know that. Private healthcare has continued to exist, paid for largely by private insurance. Most health insurance products are distributed by National Health Services. We all know that, don't we? So we have to look at rural and urban. While people, those in rural area, they struggle, okay?
Yeah.
Because you may not have an hospital that is closer to you, so you might need to travel very far, don't they? Before, if you're in a village somewhere, are you there?
I'm here with you, sir.
So they have to struggle travel very far to be able to access a hospital or healthcare provider, So those are the areas you have to look into. 1 minute. No, you do it, no. And maybe I see this. I just want to know before. So we have to look into the rural and urban. So whilst urban we quite lucky to have most hospitals surrounded us. You understand? For instance, Manchester, we have over more than 5 or 6 or even 10 across. We have North Manchester, we have MRI Hospital, we have Suffolk. In fact, every place have a hospital. Okay.
Okay.
Where are you based, Just? Where are you based?
Me? I'm in
Yeah.
Dartford.
In London.
Yeah, in London.
Okay, so there's a lot of hospitals around you, isn't it?
Yeah, there is. There are big specialists and there are GPs all around me here.
Yeah,
Yeah.
exactly. So, but the rural people don't have that, do they? Or they may
I
live in
don't.
the village somewhere. They have to travel very far, isn't it? So
Yes.
the the NHS have to structure such a way that those who live in rural areas would have some sort of facilities closer to them, isn't it?
Yes.
Exactly. You understand? Yeah. Boom. So this is so it should be strategic. So there should be a way of coming out with something that would see how those living in rural areas can sort of have access to also something closer to them. You understand?
Yeah.
So that's what you meant. So so we have countryside agency. Especially those in countryside. You know what I mean?
Yes, sir.
Countryside, and the rich people. Some of them live in the bush. You know about that.
Yeah, I
They
do.
like to live very far, far from city.
Yeah, from
Exactly.
people.
Those who are into farming, and cattle, they live there. So they
Yeah.
have to travel very far to the nearest hospital or something. So there should be some kind of, what I mean, organization to help them. So you have the countryside agency. And what they do is that they better the life of people in countryside and improve quality of countryside for everyone. Okay?
Yeah.
Exactly. Then we have to look into the health and social care 2012. And the health and social care 2012, all it seeks to look at addressing the inequalities amongst the society. And it includes duties for health bodies, including Department of Health, Public Health England, CCG groups, the NHS England, which require the bodies to have due regard to reducing health inequalities between people of England. Then we have the Equality Act 2010. You know about that equality, don't you?
Yeah, I do.
Exactly. Then Social Value Act, you know about that. It requires public sector commissioners, including local authorities and healthcare bodies. So these are things you know about, I think.
Yes,
Then
sir.
we know about the legislations and self-regulation. Again, I think I spoke about that. The Health and Safety Act 1974. What it does is that it underscores the various methodologies that employers have to put in place for the health and safety of the staff themselves and the patients. Okay.
Yeah.
Yes. And then we talk about control of how you know about cost, don't you?
About
Cost.
what, sir?
You know about that, don't you?
No, sir.
Oh, have you not been trained on that? Control of
On
substances
call.
as adults. Yeah, you should have done care training by now. Care
Yeah, I've
certificate
done.
training.
I've
Yeah,
done.
it's on your training. You know,
Okay.
control of substances hazardous to health and regulation. You should know about that.
Yeah, I know. I
Which is
have.
designed to protect people from hazardous substances. Like,
Okay.
in the care home or supported living, sometimes you have to put on aprons, you have to put on gloves.
Yeah, yeah, yeah. I know about it.
Exactly. So we call them kosh. You need to know the chemicals you are using here. And sometimes the fire extinguishers, we learn about them. Okay.
Okay.
What red means, what blue means, and what can be
Ah,
used at certain time when there's a fire outbreak. Okay.
Okay.
Exactly. So then we also know about reporting injuries and diseases, what we call RIDDOR. You know about that?
Yeah, I
You know
do.
how to report incidents when they happen, okay? And
Okay.
all that. These are things that we need to know. And as a carer, you should know about this because in all your care trainings, you have these things there. Okay. Then you have the expenditure in here. So these are some of your questions. You remember your expenditure.
Okay.
You remember the questions I spoke about yesterday.
Yes, sir.
Your expenditure. So this you have to respond. You have to read about this. All right. All right. You have to look at as of June 2021, healthcare spending in the United Kingdom um, has gradually increased since 1997 when it amounted to 65 million pounds. In 2019, healthcare expenditure in the UK stood up to 225 billion British pounds. There was an increase in 30.1 billion. So there's always an increase. Because a lot of people are coming, isn't it?
Yeah, they are. Every
So
year.
there's that demand. And that is why
Yes.
they are taxing us so much. Visa fees has been increased, isn't it? Too much tax.
So
Uh,
much.
skilled visas are coming. And because they have to pay, they have a lot of money. These are all funding that you are going to enjoy from. So so
Yeah.
employment, again, no more people have. So employment has also quadrupled, isn't it? You know,
Yes.
more healthcare professional, more nurses every now and then because we need more people to work. Percentage of GDP has also increased, isn't it?
Yeah, it has.
It has increased as well, of course. It has increased. Very, very important. And then you can read about them. Then we have to look at um, the size, population size has also increased from 2017. Huge increase of population in the UK, and therefore it means that the number of people here would actually override the number of funding that is available. You understand?
Yeah.
And state funding, the NHS is funded by the general tax. We all know about that, you know. And then you have to look at private insurance. I mentioned that to you. That what it does is that you pay monthly premium, and then when you have an issue, they'll take care of you. So that's what it is.
Okay.
Yeah,
Okay.
that's what it is. Yes, yes. It's like just like your own car insurance. Okay, the same
Yeah.
thing. You pay monthly. When you have issue, they will take care of it. Okay.
Mm.
There are about 250 NHS. There are charities organizations here as well that help. A lot of charity organizations that also help government support and all that. Again, spending, you can read about it. A lot of spending that goes on from 2017 to date, you know. And then regulation. What is regulation? Regulations play a major role in care insurance coverage. Regulatory agencies protect and regulate public health at every level. That is true. One of it is CQC. I think I spoke about this some time ago.
Yeah,
Okay.
you did.
Yeah,
Yeah.
so we don't have to go, but CQC, regulates, and they inspect, regulate and inspect, and other, okay, regulate and inspect other organizations. So CQC regulates and inspects organizations. What CQ does is that they operate and 1 minute. Lydia, Lydia, not sure. No, before is one. Okay. I think we still go front to the pleasure. So CQC, what they do is they regulate and inspect organizations. I think I did. I've given you a lot of information about CQC, haven't I, before?
Yeah, you did. On
So
our
let's
last
proceed.
previous
Yes.
lectures.
And then the other regulatory bodies, we all know the General Chiropractic Council that regulates other professions. General Dental Council, they regulate the dental professions. And the General Medical Council, they regulate doctors and consultants. The General Optical Council, they regulate opticians. And name them, MSc, and name them. Then we have the CPC that regulates paramedics, orthopedics, um, clinical scientists, name them, department practitioners and all that, you know. The General Pharmaceutical Council that regulates pharmacists, um, the Northern Ireland Social Care Council that regulates the social care workforce in Northern Ireland, Social Care Wales, the social care workforce that regulates Scottish Social Service Council that is responsible for registering people who work in social care. So where CQC does that for England, okay?
Yeah.
In Scotland, it is called the Scottish Social Services, okay?
Mm-hmm.
We also have what we call the Inspectorate Organization that also regulates in Scotland, okay? So you
Okay.
can also have to analyze your health and social care spending in your choosing country. Public spending on adult social care is massive in the UK. It's very massive, okay?
Okay.
So you can see the pie chart. You can see the Department of Health and Social Care budget. It's
Yeah.
massive. Yeah, it's massive. 2022, the highest was 2021, 63.4. And then we have 22.4 as well. So it's massive. It's massive. Analyze health and social care spending for your chosen country. Funding for health services in England comes from the Department of Health and Social Care budget. Plan spending for the Department of Health and Social Care in England after 250 million. It's massive. You can include it's massive. It's massive. So these are things that you have to look into.
Okay.
Then you have to analyze the health and social care spending to your choosing country. Most of the department's core budget, excluding COVID-19 spending, is revenue funding for spending on day-to-day items such as staff, salaries, and medicines. The remainder is for capital spending on buildings and equipment. The majority of this budget is transferred to NHS England and NHS improvement for spending on health services. The rest is allocated to other national bodies for spending on other health-related funds, such as public health, training, development of NHS staff, and regulating the quality of care. Very important.
Okay.
So, what are the recent changes to funding? During the period of austerity that followed to the economic crash, the health and social care budget continued to grow, but at a slower pace than previous years. Budgets rose by 1.4% each year on average, adjusting for inflation in the next 10 years compared to 37 average. So it's always an increase. NHS 5-year funding deal. You have to look at the 5-year. The funding rise by 33.9 billion in cash terms by 2023 compared to 2018-19, a rate of increase that is closer to but slower than the long-term average. The long-term funding deal only applies to services within the scope of NHS England mandate and excludes important areas of the Department of Health and Social Care budget, such as capital investment, public health, and education and training of NHS staff. Very key. Very key. Then you have to look into the manifesto of commitment of COVID-19. You can read about this as well.
Okay.
Okay. Then you have to look into the various budgets across board, the COVID-19 funding, which was available at the time when the COVID happened. So these are key things. So in general, we looked at today's lectures, we looked at the aims of health and social care provision, the organization of health and social care provision within the UK, the size of the health and social care sector within the UK, how health and social care provision is funded within the UK, how the sector is regulated in the UK, and health and social care spending in the UK. Okay? And there are references that we can tap into. Right, Ademi, today we have been behind time. So because of the internet one. So any other question?
No, sir.
At all. No question at all.
No question. I'm
All right.
okay.
Then I think so you can continue with your assignment, okay?
Okay, sir.
All right. Thank you so much. I called your boss as well, so he says he's going to call me back. Okay.
Okay.
All right, thanks so much. Thanks so
Okay,
much.
you're welcome.
Bye.
Thank you.
Bye.
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 Now two, three. Nti sɛ hyɛ da ɔtɔ gye mu ɛnyɛ me phone ɛyɛ nya phone ɛyɛ me group ɛnyɛ ade ake me phone biara.